every once in a while. West body. Because we usually see.
So here's your bolsters. What I like to do is divide a sheet up into thirds and then roll a skinny pillowcase up. Okay, these are like really super skinny, but you roll them up pretty tight and you get a pretty good bolster. And then I tape it with athletic tape and put it in a pillowcase and just reuse it. So that's a firm bolster, because you need a pretty good firm bolster. I like one maybe a little bit bigger than this, but we'll see how it positions her. So I want to open up the left side, so I'm gonna lay her on her right side. And I tell the patient what I'm doing, okay? So I tell the patient I just wanna bring this down just a little bit. Okay, so we're okay there. Okay, as long as we're getting side bending at that area, we're probably getting the whole area. And are you comfortable in this position? So I start out in side lying, and I will flex the knees, right? So you flex up to the level that you want to open, or basically the entire lumbar spine. Yes. Oh, sorry. Paul, will you hit the camera, please? Thanks. Y'all should interrupt me before that. That's good. So flex up to the level. Okay. And and so that, in this position is where I'm going to leave her just to start out with for a few minutes to see if she's comfortable. Now this patient would not have been comfortable initially in this position. I started him in prone and started doing a little of the soft tissue work, and I'll go ahead and do that here in a second, but I do want to review positional distraction. So if he can tolerate this position, then what do you do next? Bring the top shoulder back. And what does this do? Just a little rotation there. What does this do? What's the purpose? What?
Is it gap or left?
Nope. Well, maybe. Yeah. Yeah, it's left rotation. That's good. But what's the purpose of this? It opens the intervertebral foramen. So yes, it does do that, but along with that, it opens, the main thing is that it opens the intervertebral foramen and allows for that nerve root to have a little space. So if it is being compressed by the disc or inflammation or whatever, it usually can tolerate this position pretty well. What might you expect the patient to feel? Nothing? Reduction in symptoms? Yep, that would be good. Pain's moving up. Doesn't happen all the time. Rarely. The first time anyway. Sometimes it does. What else might you expect the patient to feel? So there is something else, obviously. The patient might experience some tingling. Did you talk about that in modalities? No? Okay, so the patient might experience a little bit of tingling. And that may be because it's kind of like when your foot goes to sleep and you release pressure off of the nerve, the vascular supply. If you're releasing the pressure, sometimes they get this odd tingling feeling. And so what I tell them is, are you feeling any sensations? Yeah, I'm getting this weird tingling down in my butt and the side of my leg. Is it pain? No, it's not pain, it's just tingling. And so I explain to them, let's hang out here for a little bit. That can be a really good thing because that tells me it's probably taking the pressure off the nerve root. Kind of like when your foot goes to sleep and you've sat, on your knees too long, and then you stand up and you get this tingling in your lower legs. So you're taking the pressure off. Let's see, can you handle it? Sometimes it's so aggravating for the patient they can't handle it. So I'll back them off just a little bit. I'll take them out of the side bending or take them out of the rotation. I think the most important component of this is the flexion and side bending, okay? The rotation, bringing them back into the rotated position, okay, opens it up a little further. This isn't a rotation manipulation, okay? It is just a sustained positioning to open up the intervertebral foramen, okay? So I'll start with about 5 minutes. Usually I'm in there with the patient, working on the note, talking to them, asking them about their symptoms, and that will be the first treatment. for that day. And then I'll send them, if they tolerate it well, that's what they'll do at home. How many times a day? Twice, once, 3 times. At least twice if you can. I tell them if they can, I tell them 3 times a day and hope they get it in once. No, I tell them 3 times a day, and if they can, that's ideal, but that doesn't work in everybody's schedule. So, and I teach the patient how to make the pillow, and show them how to use that, in terms of where to place it. And they need to be on a firm bed, not a couch where they're gonna sink in. That's another issue. Sometimes just on the floor is a good position, as long as they can get up and down from the floor. So, anything else you would add to that? Okay. All right. You taped this, didn't you, for patients and send them the video home? So that they can see the, on a, can you message it?
Yeah, message it or.
Is it on YouTube?
Actually, having a YouTube site, that's a little tricky.
Okay.
Usually I'll just verbally describe it and record it when they're doing it on their phone.
Yeah.
Just give them their phone.
And so you understand, giving them their phone, it's their device, you're not using hospital or clinic or, public health information going over public, sites, so have to be careful with that. All right, do you mind laying down with your head on that end? So that's positional distraction. So when I start out with this patient, he needed to lie down with a pillow underneath his stomach. He couldn't tolerate just prone lying. I wanted to see if he could lie prone without a pillow, and he could not, okay? I put a pillow underneath his legs. And he did I talk about straight leg raise on this patient? Okay, I was there, I don't think I talked about it. But anyway, bending the knees sometimes like this can be more comfortable for them if they do general tension. Okay. So just a little trick to get them more relaxed. And then I just started with soft tissue techniques. Okay, so what you learned in massage, in modalities, just going up the spine, working to reduce the muscle guarding. Okay. And I could also do just a little bit of the transverse process, PAs. I'm just doing about a grade 2 to reduce muscle guarding. Okay. So I'm not going to end range. I'm not producing a lot of rotation. Another thing I could do, which I didn't show you in terms of a manipulation, is you could just do PA oscillations. Okay, we'll talk about that a little bit more. So transverse process, and I can also do the side bend manipulation. Okay, and to improve opening on that left side. All right, but really worked to get him to where he could actually tolerate normal upright standing. Okay, because he was slightly forward bent. Okay, and we did get to the point where we were able to take the pillow out. He didn't have increased leg symptoms, and he was able to tolerate the positional distraction over time. So how long do you keep the patient in positional distraction? Or what's your goal? How long do you want them to be able to tolerate it? What's the longest time you would send someone home with it? 20 to 30 minutes. Yeah, 20 minutes is usually 20 to 30 minutes over that is a good amount of time. What else? All right, so what I want you to do, if you want to practice positional distraction, you can, but I do want you to do the lumbar side bending manipulation. The hip abduction, okay, review that. If that's something I would do with this patient. And I would like you to practice positional distraction just to make sure you can set it up correctly for the